Let's discuss organophosphate poisonings, also called pesticide poisonings. Here's everything you need to know about organophosphate poisoning. Organophosphates inhibit acetylcholine esterase, an enzyme responsible for breaking down acetylcholine, leading to excessive parasympathetic nervous system stimulation. This results in widespread muscle overstimulation, respiratory compromise, and secretory overload. Organophosphates are often used in pesticides. They are considered nerve agents as they disrupt the normal nerve function. Patients experiencing organophosphate poisonings present with SLUDGE-M symptoms. SLUDGE-M stands for salivation, lacrimation, urination, defecation, gastrointestinal distress, emesis, and meiosis. Salivation refers to the excessive saliva production. Lacrimation refers to tearing, or the production of tears. Urination refers to incontinence to urine, and defecation refers to the incontinence to feces. Gastrointestinal distress refers to the other GI problems that a patient may experience, and emesis refers to vomiting. Lastly, meiosis means constricted pupils. Other signs can include bronchospasms, bradycardia, muscle twitching, seizures, and respiratory failure. A key diagnostic feature of an organophosphate poisoning is the presence of 3 or more SLUDGE-M symptoms, especially after a patient has been exposed to chemicals or has been out in a farmland where pesticides might have been used. Patients suffering from an organophosphate poisoning may need atropine and Pralidoxime chloride. Atropine is used to counteract bradycardia and secretions, while Pralidoxime chloride is used to reactivate acetylcholine esterase and relieve neuromuscular symptoms. If these medications are available, you should use them on yourself first, and if they are still available for the patients, you should then use them on the patients. In many cases, these come in a set known as a duodote, or duo meaning both medications, and dote referring to dose. Other treatment includes providing supportive care and rapidly transporting the patient to the hospital. ALS providers may be able to initiate IV access and administer additional treatments if indicated. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.